Welcome back. Well, back pain affects millions of people, and the severity of that pain may determine the treatment approach that you should take. And joining us once again is Dr. David Doward. He is part of the team at Jacksonville Orthopaedic Institute. Good to see you, sir. Thanks for joining us once again.
Thanks for having me.
I'll tell you what, this is something that affects so many people. I know in my family, I can name on the top of my head 3 or 4 people I know who suffer from back pain. So first of all, if someone is suffering from back pain, what are some of the most common treatments that you provide for those patients to get relief?
Sure. Typically, if someone's having back pain, we have them do some sort of activity modification, some rest. We have them try some anti-inflammatories. If that doesn't work, we have them do physical therapy, which really works on reducing their pain, working on their flexibility and their core strength. If those things fail, then the next thing we do are what are called image-guided injections. These are very specific injections geared towards treating very specific pain generators in your back.
How do they work? You say they're image guided, so how do these, and what are you injecting then?
Sure. We're injecting a little bit of steroid. It's done in a procedure room under sterile conditions. We're targeting a very specific pain generator that we've identified once we've worked you up in our office. And the steroid itself wipes out the inflammation which is causing the pain. The steroid might go around a nerve, it might go into the disc, it might go into the joints in your back.
How often do you have to get this? Is this something that hopefully you get done 2 or 3 times and then it works itself out and you don't have to get these injections into the future?
Sure. This isn't something you need to continuously do. If you have a herniated disc, you might have 1 or 2 or 3 injections, that in conjunction with physical therapy, and then I may never see you again. Your body has an incredible ability to heal itself, and that disc herniation can be reabsorbed.
So is the physical therapy that you're doing with these injections really a key component to the success that you're seeing with your patients?
Absolutely. Anything that improves your biomechanics, anything that makes your body work more efficiently, keeps you from re-injuring that specific area in your back.
So this is from an injury. You know, somebody's out in the garden, they kind of do something, they twinge it a little bit. What if the injections aren't working? What do you do at that point in time? Or how often does that even happen? Do these injections work a good percentage of the time?
Sure. Most people get better with a combination of physical therapy and injections. I say 90% of the population does. 10% need to go on to have either surgery. Maybe they need to have a surgical decompression or a microdiscectomy. Or they may even have to have additional physical therapy. If someone has already had surgery, we've tried the injections post-surgery as well, and they're not getting better, then there are additional procedures that we can do, such as a spinal cord stimulator trial, which actually scrambles the signal to your brain and can give you incredible pain relief.
So has technology really advanced over the years? Because I know there are some people who are scared to death. If their back starts to hurt them, they don't want to do anything about it because they're afraid of what might happen with their back. But you're saying there's so many things that you could do leading up to the point of surgery, and even after surgery there are things you can do.
Right, there's so many options now. The most important thing, is to get an appropriate workup, going to a spine specialist so they can make a very accurate diagnosis, and then they can kind of guide your care. I'm always a big proponent for conservative care, but when we need to do it, then we also do surgery as well.
How important is it if someone experiences an injury or they wake up one morning and they have pain and it's been there for a couple days, they've tried the anti-inflammatories on their own, how important is it for someone to come see you? Because are there instances where it might not get better or it could get worse, or let's just kind of nip this thing in the bud early, right?
Right. I think it's always important. I think if you're experiencing back pain that's persistent longer than 7 to 10 days, definitely within a 2-week time period that's not getting better, or if you're having any kind of neurological problems, you want to get that evaluated by a spine specialist and then let them guide your care and help you to get better.
Right. Try to do something early, right? I know, and I won't name names, Dad, but people who are just so afraid that they deal with the pain, but it just seems like nowadays you don't have to do that. There's so many options to get relief.
You don't have to do that, and also you don't want to deal with pain for long periods of time, because then it becomes chronic and it can become a lot more difficult to treat.
There you go. All right. Good to see you, Dr. Doward. As always, appreciate you taking the time to join us.
Yeah, it's wonderful seeing you.
Good deal. All right. And thanks, of course, to the Jacksonville Orthopaedic Institute for coming on and providing all of this great content. For more information, you can log on to their website, which is simply joi.net. You can also call their main line number, which is 904-JOI-2000.